Thank you, Vinay. I'll just touch a line about my pre-Pushpanjali days. Born and brought up in East Delhi, and half of my life I spent in Pushpanjali. Started from a tented school. Now am I sharing my views with you all sitting in an air-conditioned room. I mean, to tell, Vinay is one of my mentors. Thank you, Vinay, for giving me the opportunity. All this is our pre-Pushpanjali days, and I think before I start, I must pay my homage to respected Dr. M.M. Agarwal and Dr. Satya Jain, our parents, and without their blessings, and still I'll seek their blessings, and they have been with all of us, and there's hardly any activity in Pushpanjali till their death which they have not attended. Please keep blessing your, keep showering your blessings to all of us. Vinay, I think this institutional growth and expansion, probably it is not a correct topic. Vinay is an institution in himself. All the details written here are well known to everybody. But I think this institution, this is a professional journey. Vinay, I must congratulate you. Apart from your professional journey, you have taken good care of your family. And I think hats off to Vinay ji and Sudesh madam. Gaurav is a big man today. He is CEO of a big group of corporate hospital. Garma is doing well as a nephrologist. And Sujanya, you know all of them. So this is all his vision. Apart from professional vision, he has taken care of grooming his children also. Please. Pushpanjali was established in 1989. When we started, it was 10-bedded hospital. And basic facilities were there. Started with internal medicine, general surgery, pediatrics, gynae and lab services. In spite of limited diagnostics, it was more of a passionate care which kept us united throughout our life. And now Pushpanjali has grown from a 10-bedded hospital to a multi-specialty hospital, and journey is still continuing. This is the Vinay, a thinker. He's not a thinker, he's a doer. He started from this and where we are today. This is the initial, just our Pushpanjali Medical Centre is 10-bedded, double-story building, and board you are seeing, just behind this was the office of Dr. Vinay Agarwal, who is a big man now. Vinay, I still remember, we used to make our bills together. And there was no telephones in those days, nothing. But it was all efforts of all of us. And how the journey continued from one building to another. And now I think we are covering almost half of Pushpanjali as Pushpanjali Medical Centre. This is the latest view of Pushpanjali Medical Centre. Initially, when we were 10-bedded, we had this picture as our emergency, ICU, OT and all those things. Please. And we have upgraded. The reception is there. It was chairman's office initially. Now the whole ground floor has been taken over. There is ultrasound room and endoscopy room apart from little bit of reception there. OT is a big kind of thing. Almost we are turning 3 or 4 OTs. Modular OTs are there. Our ICU is a very well equipped place because things are different now. The instances I am going to quote will take my colleagues from Pushpanjali Medical Centre down the memory lane. But it will be eye-opener for those, probably those who have joined us today. From Pushpanjali Medical Centre, then a concept of started cooperative corporate movement. And all of us under the vision of Vinay we joined and started Pushpanjali Crossley Hospital, and subsequently it was taken over by Max and so on and so forth. But still, we have got a dream. All of us have become dreamers, all of us. And I think dreaming is something else, and giving it to a practical shape, I think this have a family practice of Pushpanjali. These are the initial logos. Clinical Diagnostic Center was initially a small clinic, and subsequently it grew into a Diagnostics Private Limited, and all of us became directors in that. And because of our busy schedule in Pushpanjali Crossley Hospital and rest of the places, and now the CDC is run by Dr. P.D. Garg and Dr. Swaraj Garg. Similarly, Feminist is another name. It's not only name in East Delhi, it is going to be a brand in NCR and more so maybe in other states also in near future. This will be launched soon, Feminist. Bird's eye view of Feminist. And I think dream come true from that office which I was telling, where we discussed chai pe charcha zarur honi chahiye, and now I think this whole floor to have chai pe charcha is a complete kind of setup. We are going to have almost 30 bedded conference room there. All account section is separate, other separate. This is some of the clips I have taken. I think this is the power of Pushpanjali. The real story starts now. Dr. Grover, Dr. Sharda Jain, Dr. Sudhir Singhal, he was been with us from the very beginning. He has been financial advisor and now he is one of the directors of the organization. Dr. Jham, Dr. Deepak Pandey, Dr. Neeraj Jain. Ashok has been, I think, he was associate professor in GTB Hospital and that medical college. We requested him. He has been a great clinician and academics par excellence. Thank you, Ashok, always standing by with us. Dr. Sharda Jain was inducted into Pushpanjali when she was probably on faculty of Lady Hardinge Medical College, and so was Dr. Sudhir Jain. Initially, he was part of Clinical Diagnostic Center. Yogesh Jham. I think Yogesh and me have got a very pleasant long association. Since 1984, we started a Pridarshini Polyclinic in Lakshmi Nagar. Yogesh initially used to do clinic in my clinic in Gandhinagar. There was no space. When he used to see patient, I used to sit in my room and vice versa. And there's hardly any, my family members, he has practically operated all of them. My mother, my sister-in-law, and so on and so forth. And I think it was his surgical skills which forced all of us to induct into Pushpanjali family. Neeraj, I remember your first interaction with you. You had just started your gastro practice, and I requested you to come and do endoscopy in none of my patients Pasi nursing home. That was 85 or 86. And since then, there's no looking back. Nowadays, at times, patient requests me, Dr. Sahab द्वारा नीरज जैन की appointment ले दीजिए, and I willingly do that. Thank you. Deepak Pandey, the lesser we speak, the better it is. Full of wits, Vaneet, a serious person and good critic in all these things. Rajesh Dhal, Dr. Atre, they have been all of them with us for the last almost 35 years now. Mukesh Ajmera. When we first Dr. Mukesh Ajmera, he has just done his membership in echocardiography escorts. We requested Mukesh, please join Pushpanjali family. There was a bit of reluctance. Then me and Ashok sat down with him, told him, look, if you are thinking ki we'll learn echocardiography and use this machine, we will not do that. And till date, he is the most sought after echocardiographists, rather I'll put it, non-invasive cardiologist in East Delhi. And humble soul, thorough gentleman. Mukesh Kaushal, his story also long, and he has been with us from those days when ultrasound used to be a rarity in East Delhi. Manish initially joined us as intensivist, now he is medical director, and he is taking care of all of us. Thank you, Manish. Unfortunately, we lost two of our very good colleagues, Dr. Girish Chabda, who has been with us for ages, and Dr. B.K. Malik. And his son was admitted with us last week with a fracture himself. Anyway, this story is continuing. Staff integrity and ethical working has been backbone of Pushpanjali family. Late Mr. Ramesh Thakur ji, हम इनको ठाकुर जी कहते थे चौकीदार, पर सारे कहते जी से थे उनको. And now he has left his legacy in Manoj and Girdhari, who is actually a technician, and Manoj is a facility manager. Rajesh has been with us more than Pushpanjali, I say. He has been with Vinay since ages. He joined Pushpanjali as GDA, and now he is head of reception in TPA. Lalit Hamma, he's a chief administrator, started as a nurse here, and Deepa Bhatnagar started as a accountant, and now she is finance head. And that's how the commitment to Pushpanjali goes. And few instances, dedication is more important than designation. This again is for that humble soul, Thakurji. I remember incidents. A couple came from Canada under care of Dr. Sharda Jain. The lady was pregnant and she had advised for cesarean section. As my colleague in the previous talk was telling, written consent is very important. So she took a written consent, we refuse for cesarean. And they went home. Next day, when she came, that lady, there was IUD. And the whole family was very rough with all of us. It was Thakurji who dragged the male persons to the police station, although they were connected with the Labour Commissioner of Delhi. But in the end, I think everything was well, and they gave a written apology to Pushpanjali Medical Centre. That's how the things are sorted out. That is the dedication. Sincerity, loyalty are more important than seniority and royalty. Why I am telling is because I told you the story of Rajesh. Rajesh started as GDA. One patient whose brother has been a leading physician of East Delhi, whose husband was a leading physician in a town in UP. They were running nursing home there. Hysterectomy was done. And after 48 hours or so, that lady collapsed in the room. Both the physicians were there, brother and the husband. They said, no, we'll manage here. It was Rajesh who carried her to the ICU in a pulseless state. And whole team was organized. The patient was thoroughly evaluated. And in those days, we had tied up with National Heart Institute. There were no mobiles, nothing. Me, Ashok and Dr. Ashmera, we managed, and it was detected that she has heart pulmonary embolism. So telephonically, we were in touch with our cardiology team, and all of us kept on struggling, including our leading physician friend from East Delhi. And end of the day, story was positive. She survived and was discharged after a few days. That is the value of sincerity and integrity of the person. Values are more important than valuables. Dr. B.K. Jalali, majority of us may not know him. I have yet to see a surgeon of his caliber. He was professor of surgery in Srinagar and Jammu medical colleges. During 1984 or so, because of those incidences which you like to forget, he shifted to Delhi and he was with us for a few days. One of my patients operated upon, 13 or 14 years of age, he did the appendectomy. He was son of the SHO of Anand Vihar. After he came out from the OT and look at him, he says, सरदार जी, आपके बेटे को अपेंडिसाइटिस नहीं था, पर मैंने फिर भी अपेंडिसेक्टमी कर दी, क्योंकि एक बारी मैंने खोला था तो मैंने सोचा बाद में परेशान न करे, कर दो. That truthfulness, values, and I still remember another incident of this great soul. Some hot discussion was going on in a chamber of Dr. Vinay Agarwal. Tempers are very high. Dr. Jalali was also part of the. He said, look, if the person is speaking truth, only truth, and nothing but truth, then we must end this talk here. That's how the hot tempers, everything settled down in a minute. These are the values. These are the values of Pushpanjali. So any amount, any finances, they cannot meet all these things. And when he left, he told Vinay, हमसे senior थे. He was, I think, from first batch of Maulana Azad Medical College. Vinay, तूने कोशिश तो पूरी कर ली कि कोई patient में मरा हुआ छोड़ जाऊं, पर किसी को नहीं छोड़ के जा रहा हूं. He did decortication in one of my patients. He did thyroidectomies and all sorts of surgeries, and all were positive. That was Dr. B.K. Jalali, and we are still in touch. Great human being, full of it. Team efforts are more important than results. I saw a patient. She had admitted for fever after, say, delivery. Almost 2-3 weeks have passed. 2-3 weeks have passed. She was just eating her dinner. In those days, there were no mobiles, nothing. I was having a scooter. I reached Krishan Nagar and found that pager is ringing. Dekha, Pushpanjali Medical Centre. I came back to Pushpanjali rather going to my clinic, and it was shock of the day. That lady collapsed in the room after dinner, and Dr. Dr. Dhal was she intubated her using ambush bag, and Dr. Dhal continued this procedure almost for 24 hours till we organized for a ventilatory support. And unfortunately, in spite of all efforts, we lost that young lady. But still, we, all of us, worked as a team, tried our best. I think this is another case. I think few of you may be knowing Dr. Raghu Gupta. He was practicing in Shakarpur. He called me कि there is a friend of mine who is a ISFer who has recently resigned. He's running NGO. I'm bringing his father to you. So I talked to Ajmera. He was there at that time. It was seen that he had probably inferior wall MI. And Dr. Ajmera thrombolized the patient. And by 12 o'clock, as usual, I also reached there. In my chamber, we had tea with that gentleman, I mean his son, patient's son. And while going to ICU, I told, look, sir, MI coronary is unpredictable. You don't know what to happen next. Anyway, once I reached ICU, all of my staff, they were struggling. And I was also party in that struggle. There was hardly any complication of MI which was not seen. Full doses of inotropes and so on and so forth, everything. I was a courtesy consultant in Max in those days. Dr. Singhania was heading Department of Cardiology. Dr. Yaduvanshi was with him. I requested them. I think started at around 1 p.m. until 6 o'clock. Balloon, aortic balloon was arranged, it was inserted, but patient was very, very unstable. We shifted the patient to Escort Hospital, where he kept on having all sorts of complications. There he had pulmonary embolism and septicemia and so on and so forth. But those initial offers of our efforts, that gentleman came after 2 months and to say thanks to the Pushpanjali family. That is the team efforts. And this gentleman happens to be a ex-Chief Minister of Delhi now. Documentation, as my colleague Dr. Rakesh Gupta and Gaurav has told, this is one case, young man, chartered accountant, brought to Pushpanjali at 1 a.m. the night. Dr. Sangeeta Bhargav, she was with us in those days. She came to attend her. All possible things were done. And she updated everything, took the written consent, and X-rays, whatsoever was possible, it was done. Around 6 o'clock in the morning, me and Dr. Grover were called to the ICU. We reached there and we thought he requires ventilation. But definitely, the young boy was very, very sick. Hats off to Dr. Grover. The documentation is perfect. The counseling is perfect. And again, Dr. Dhal came to our rescue. We shifted the patient. In those days, we were in touch with Delhi Heart Lung Hospital at Panchkuya Road. And after a few hours, the patient died. We were dragged to the court. And then I came to know the brother and sister of the deceased, they were from legal kind of profession. This thing happened 2 or 3 months after we lost that patient. And claim was around 80 lakhs or so. They went to the State Forum. State Forum, they saw all the records. We were not called. And State Forum judge said, no, itna claim to nahi banta. You go to the District Forum. So in District Forum, both of us were called. And our legal advisor, Alok ji, if you may be knowing, and unki team, they presented all the documents and everything. And end of the day, the court said, इसमें कोई भी negligence नहीं है. The court, it went on for almost 6 months to 1 year. The family again went to the court, State Forum, saying कि हमको तो न्याय नहीं मिला. Again we came back to the same District Forum, the same judge, the same story, the same legal advisors, everything. तो जज का कहना था, आप बार बार आ जाते हो, इसमें दिखाओ तो सही negligence कहाँ है? That is the value of documentation. Not only documentation, proper treatment also. Because one has to have proper treatment, then document it. And there, all the places it was well signed. So, the good documentation saved us. Dedication beyond duty. Where are Deepak today? He has been a regular donor. He donated blood to so many patients himself. And our staff at times overworked for almost 2 to 3 days in a stretch. Culture of selfless service and compassion is the story of Pushpanjali Medical Centre. Sir. Apart from our professional kind of things, we had very eminent personalities visiting the hospital. And it has been visited by none other than Rajnath Singh ji, Dr. Sushma Swaraj, Paramananji Maharaj, he is a trustee of Ayodhya movement. Sadhvi Tamraji is, all of you know, she is Didi Ma now, recently been conferred with the Padma Bhushan. And so many media picture, if you left, if you can see, Anupam Kher in a, attending one of the events. And right in the end, that Dr. Sushma, Mrs. Sushma Swaraj, she was inaugurating a function or national kind of thing that was in the park nearby 11 now, where his office now. I mean, I think I'm fortunate to be associated with Guruji, and I always seek his blessings. And his son Paramananji Maharaj, he is Guru of Sadhvi Tamraji. He regularly gets admitted in Pushpanjali, and he had coronary and CVA and all those things, still going strong. I got a call a few months ago during that Kumbh Mela. His colleague Swami Jyotirmay ji told me कि स्वामी जी को ऐसा ऐसा हो गया, तो मैंने कहा there is no get to panic. If you go to the hospital there, I mean there was a camp hospital, cardiology was based there. I told them it's better to shift him, and they are very influential people. So Yogi ji was informed and he was shifted to AIMS. And after that he came to me, and that's how the things still are on and off. We just give telephonically, we are in touch. Second, Rupani ji. He is the ex-Chief Minister of Gujarat. He visited Pushpanjali. This happened last year. It was just to discuss in those days, parliament elections were due. They wanted to discuss with the medical colleagues and Vinay in particular, how to manage about doctors' kind of voting pattern and all those things. And he spent almost 1 hour. Rest of the dignitaries are from his team, his party. I think apart from all big things, all dignitaries from Indian Medical Association, Delhi Medical Association officers are involved in the activities of Pushpanjali Medical Centre. Apart from MLAs, MPs of this area, I mean this is only because our ethical practice, our team efforts. And I think East Delhi is, we are famous in East Delhi, rather I'll put NCR. And Vinay of course is a now celebrity now. Going to IMA and Wonka and all those things. These are few of the from national media reports. Academics has been core of our organization. Pushpanjali publications, our monthly clinical meetings. When it was 10-bedded hospital, even then we used to conduct clinical meetings in the basement, where is our OPD at present. We hardly missed, and during these meetings, if the patient is very sick, he has been with us for say 4 or 5 days. So invariably, me, Ashok and Mukesh used to sit down and counsel the patient, giving them all the options. Monthly meetings has taken the shape of a Pushpanjali study circle. We started with 10 or 12 kind of delegates. Now you can see the number yourself. It is, I wish that this number grows more and more. And Pushpanjali Medicon We started 4 years ago. From our local kind of Medicon to this year it's going to be international Medicon. We are going to have speakers from abroad, national and international faculty is going to be there. These are the few books from Pushpanjali publication. The first one, Pregnancy, Birth and Child, has been edited by Dr. Sharda Jain. Medical Emergencies, it's a part of Pushpanjali Medical Publications, where Dr. Vinay, Dr. Ashok Grover, Dr. Rajiv Gupta and myself, we have been the members, and 3 editions were done, and more or less 20,000 books are already there in the circulation. Next is a book on family medicine, and it's still in demand. There is a possibility that near future we may come out with this book again. B.K. Gupta wrote on neurology. Dr. Yadav, O.P. Yadav, he edited book for us on ECG, and I think this is from Mamta Grover, own book. And poisoning book is edited by none other than Professor N.P. Singh. And I think medical focus and connect, medical connect. Every 3 months we have these issues. Dr. Anita Jain, she is the one brain behind it, and she invariably is doing a wonderful job. Thank you, Dr. Anita, for all these things. Beta. These are all Pushpanjali Connect and all those mayors and other things. First meeting in the boardroom, now a study circle is doing well. These are few memories of Pushpanjali Study Circle, various speakers on this podium only. Apart from our professional work, Pushpanjali is known for social activities. We had 2-3 bhajan sandhyas, very popular event. Walk for Health, I think all of us joined that. Musical events, and last one was few months ago. Pushpanjali Family Kitty. I think everybody from Pushpanjali family waits for this event. We conduct every 3 months, and it is a real fun. I mean, all the children of the family members, everything are there, dancing, enjoying and eating and whatnot. Annual dinner is always very popular event of Pushpanjali Medical Centre. I remember when it was Kanishka Hotel, we used to have there. I'm talking of early 90s. And problem with me and my family was, मेरे घर वालों ने कहना शुरू कर दिया, यार तुम तो लड़की वाले हो, सबसे पहले पहुंचते हो, सबसे बाद में जाते हो. And I think meeting used to finish when we used to give the bill, and we used to finish for a cup of coffee, Vinay and Sudesh ji. And Nurses Day celebration is a regular feature. Doctor Day celebration is a regular feature. Onam, Diwali, you name any event. And these are celebrated just like in a family. These are few clips. That's our kitty. That is our Doctor's Day, Diwali celebration, Medicon, and other activities. I think this is our Rakhi celebration. Please. These are happy hours. Huh? Good. I think I'll be failing in my duty. without giving my due thanks to my family members. Shami, my wife, Priyanka, my daughter, and Prashant, my son. I was so much absorbed in the activities of Pushpanjali Medical Centre, तो उन्होंने एक पैरोडी ही बना दी. Before I just conclude and officially say you thanks for joining this journey, the parody was जीना यहाँ, मरना यहाँ, पुष्पांजलि के सिवा जाना कहाँ. So that is पुष्पांजलि का नशा. And thank you all for being part of Pushpanjali, for joining my journey to Pushpanjali. Thank you very much. Thanks.